Hello, my name is Rihanna Lester. This is for GNSG 6700 with Dr. Deb. Thank you for joining me. I'm currently a student of Roberts in the nurse practitioner program. Today, I'll be walking you through a professional self-evaluation uh, on both my current and past education and professional experiences and how they interact with this class. As part of this class, we integrated appropriate technologies for knowledge management to improve healthcare. This is a competency that emphasizes the nurse practitioner's ability to adopt and use healthcare technologies to gather, analyze, and disseminate clinical knowledge to improve patient outcomes and organizational efficiency. So our role in integrating technology expands beyond basic documentation. This competency focuses on our ability to use technology not only to store and retrieve information, but to transform that information into actual meaningful knowledge that improves healthcare delivery. It's about mastering not just the electronic health records, but the decision support systems like UpToDate and knowledge management tools that ultimately lead to better, safer care. In this class, we learned about the healthcare cloud, which refers to the cloud computing service specifically tailored for storing and managing and processing healthcare related information. It offers us tools for scalability, interoperability, and patient data accessibility. This transforms traditional models of care, where whether used for electronic health records, telehealth consults, or population health analytics, the healthcare cloud has become a cornerstone of modern healthcare delivery. So this is going to be really important for us moving forward as nurse practitioners. We have to be efficient in navigating the patient's medical record to get a full picture of their care and actually be able to utilize that information to impact their care. We have to also be able to utilize statistics like those that can be found from the CDC and be adequately skilled in using databases such as UpToDate for decision support. Activities demonstrating proficiency in skills and knowledge management. I've used the electronic health record system for patient documentation and care planning. Conducted research using clinical databases such as CINAHL and PubMed, integrated digital care tools in professional settings. During this course and previous professional experience, I engaged with electronic health records, managed patient documentation efficiently, and used the databases we just mentioned. I've also used UpToDate and clinical support decision technology. And this way, I can make sure that whatever decisions I'm making are actually evidence-based and to the most current evidence that's available to us. I'm also proficient in LexiDrug and use that to analyze different medications and make sure that I'm cross-referencing and I'm not putting two compounds together that might interact negatively. Throughout my education, I have utilized the databases and feel rather proficient in them, and I actually look forward to learning about more of them. And as I mentioned, I plan to learn about more of them. Well, that ties into my plans for continued growth. I would like to stay ahead by participating in ongoing training in healthcare technology. I'm particularly interested in becoming comfortable with as much technology as it emerges and exploring artificial intelligence applications, because I really do think that these are going to be highly beneficial moving forward just to make care safer and to be able to quickly and easily access the most current research out there and really help our patients moving forward. This competency emphasizes the nurse practitioner's role in effectively translating complex health information into language that is meaningful for patients, caregivers, and interdisciplinary teams, tailored to their unique needs and literacy levels. This is so important that we are able to take, highly clinical information and break it down in a way that all people can understand, no matter what literacy level that they possess. So, if we're talking about a very intense illness or disease, we need to be able to bring this down to a level of understanding of our patients and make them comfortable that they understand it fully, they're not afraid, and that they know what the next steps are in terms of care and making sure that they get the care that they need and they feel supported. Ways that I have demonstrated this is developing culturally tailored education materials in professional practice. This is what I did in gastroenterology, making sure that we had our materials translated into the languages of the populations that we served there. I worked on teach back method with our patients to make sure that they understood their prep instructions and they weren't just saying yes and then coming in for a procedure not correctly prepped. That's an issue. And then uh, participating in interdisciplinary meetings to simplify care for patients. This is something that I do in urgent care so that we have proper workflows. In my professional practice, I also created patient education handouts for measles and I spoke about culturally appropriate colonoscopy patient education. I also have done teach back method with our patients in urgent care when we are giving them durable medical equipment like crutches or an air cast. So showing them how to use it and then making them present to me how to use it to make sure that they'll actually be able to apply it when they get home. My future plans include enhancing my ability to communicate effectively through visual and interactive tools, especially for patients with low health literacy. I also plan to partner more closely with health educators and social workers to design more comprehensive patient education strategies. This is particularly pertinent in my area of interest, which is urgent care. We have the ability to help connect people who truly need it with social work and resources and educate on a level that meets their needs and level of understanding because we get a wide spectrum of populations at urgent care. And so this is something that I'm really quite interested in. And I would like to do some of my continuing education units or credits in this as I move forward in my professional practice. Coaching for positive behavior change. This competency involves using motivational educational strategies to encourage patients and caregivers to adopt healthier behaviors and self management techniques. This is just beyond providing information. This competency requires us to actually act as coaches. So, supporting our patients in understanding their health behaviors and doing maybe some motivational interviewing to empower them to create the changes. And this has to be coming from an internal place. This can't be something that you just externally try to get them to adopt healthier strategies. They have to have that internal push to go ahead and make those changes. So, with motivational interviewing, it's a beautiful tool that we can use to try to get them to feel that they want to make the changes because that is the only way that true behavior change can be created. Through some real world coaching experiences that I have done as a nurse, I've used motivational interviewing for smoking cessation. You are talking to a patient, and then they actually bring up that they're interested in quitting, and then you can really just meet them halfway and have them explore their why. Having that why is what's going to bring them a little bit closer to making those changes and truly going through the steps necessary. I also use motivational interviewing and lifestyle change with interventions with bariatric patients. I led group classes So, of course, yes, you're educating on that lifestyle change in terms of exercise, eating balanced meals, having a healthy relationship with food, and why we are fueling and nourishing our body. But it, using motivational interviewing, you're exploring each patient's why, and it's really cool to watch them quite literally change their lives. It was one of my favorite positions, just collaborating with patients and behavioral health and trying to make sure that we are nourishing our bodies from the right place and we're making those changes from the right place. It was a very, very cool experience. My plans for continued growth in this behavioral health is to actually further my development of different skills such as motivational learning and different teaching skills to help create change. I also would like to learn about tech tools like mobile apps for real time patient feedback. I also would like to utilize my skills as a nurse practitioner to take on athletes and utilize my skills as a bodybuilder as well, merging things such as hormone replacement therapy for optimal performance and utilizing things such as apps to see how they are fueling themselves, how they're feeling, what is their biofeedback. So this is all areas that I'm very interested in. And then using my skills to create uh, individualized coaching plans for not only patients but for athletes as well. And in a sense, those would be patients from an HRT standpoint. Information literacy. This competency involves the ability to locate, evaluate, and effectively use information to support evidence-based clinical decisions, particularly in complex or high-stakes situations. So, for instance, in urgent care, where you want to be quicker with your services and helping as many patients as possible, you need to be able to quickly assess and know where to find the answers to the questions you're being presented with, depending on what the patient's symptoms are. Sorry. In today's digital age, information is everywhere. Not all of it is useful or trustworthy. Obviously, we've all had people use Google as a doctor, and they came back with some information that wasn't accurate. So we need to be able to appraise data, understand whether research is quality or not, and then be able to apply it to our patients. As providers, we can use peer-reviewed, well-organized resources such as UpToDate or LexiDrug, which I talk about all the time because I love them. And these databases are easy to search and they are easy to find trustworthy information. During this course, I completed several evidence-based practice assignments using different models, being able to develop PICO questions, and formulate different protocols based on evidence. So this is going to be very important in practice because we will apply this as we move forward. And understanding that PICO framework is going to be huge for just furthering research as we go along and being able to truly just piecemeal it out and find the information that we're looking for. My plans for continued growth. I always love doing CEUs, so being subscribed to clinical journals and different research alerts depending on what things I'm interested in, attending any workshops that are within my interests, and being able to just continue to read research. This is going to be huge. I plan to remain connected with current research as I move forward in my practice. I will engage in case-based learning, which that's going to happen all throughout any of our careers. As we're presented with new illnesses and symptoms, we're going to have to do that research and look into the literature to find the answers that we're looking for and how we're going to treat and help that person. So that's just going to be ongoing all throughout our careers. It's going to be important to just continue reading and analyzing research until we create true proficiency. As we move forward in our practice, we're going to continually use the EHR and decision support systems, and we'll find things that aren't necessarily the best, and will figure out new ways that are going to promote a better workflow, higher quality, maybe decreasing cost in patient care, and just being able to know who to reach out to, whether it be IT or interdisciplinary teams to change the things that we're seeing in the workflow and designing new technology that's going to make patient care more efficient and safe. The way that I've demonstrated these activities so far is within our urgent care system. I worked with other nurses to help streamline how we communicate with our providers just to make it more easy and quicker. We also worked to create better workflows in terms of our inbox. So when patients' questions come in, we're able to answer them right away. And then how we filter our inbox to make sure that all patients are having their results reviewed in a timely manner. Also, we work to streamline our policies. So we have pediatric patients come in and we have certain policies on when should we take a blood pressure? Does pulse ox matter for all patients? And these were all areas that I worked with other nurses on the team to find better workflows and a streamlined understanding for everyone. My plans for continued growth, whether it be as a nurse or as a provider, I of course want to be involved in future pilot projects to contribute to better, more easily designed clinical systems, whether it be for improvements on the patient end or as part of the team, improvements for us to make the system more easily user friendly and safer. So different alerts, making them actually show up so that way we don't have that alert fatigue, and staying updated on the latest research. And this includes research in these systems and in these technologies that are available to us. In this competency, this reflects how we use technology to gather and analyze data on nursing care and patient outcomes. This is going to be so important for quality improvement. This includes encouraging reporting of issues so that way we can lead to improvements on those issues, surveying stress levels and employee morale so we can lead to change. Using digital charting so that way we can obviously pull metrics from that charting and find ways to improve quality care. All right, so how I have worked personally uh, using these metrics is I was part of a team that advocated for haiku for inpatient and outpatient nursing for wound photography for better outcomes in terms of wound management and easier and more timely feedback from providers in terms of wound management care changes. So they were able to stay up to date on how the wound actually was healing, rather than waiting even a week, sometimes not, if not more, for a provider to actually see it. I advocated for resources in GI to have proper preparation instructions and education materials in the language of the populations we serve. And I also worked as part of a team to improve workflows. This included in rabies vaccination and physical assessments that needed to be completed during the rooming process. So it's that continuing to try to see where the issues are and then make improvements. Plans for continued growth. I plan to continue to advocate for open communication and making that comfortable environment so that way people are are, in a safe place to air whatever their concerns are or whatever errors are happening so that way we can actually fix them. Will also continue to audit workflows and different metrics. So I am on what we call the ladder, and one of the things that I do is chart audits so I can see what things are being missed and we can make improvements. And even it might just take a conversation saying, hey, you missed this. Well, in the future, could you go ahead and chart on this so that way we can make sure it's being done? I also intend to utilize the current research to improve patient care and workflows over time. My final reflection. So, honestly, this class has been quite eye-opening. This journey has reshaped my view of health informatics. I now see how powerful it is, bridging between data and compassionate personalized care. As a future FNP, being tech savvy is going to be essential to ensure safe, efficient, quality care and advocating for patients. And informatics is no longer just a skill, but this is something that is essential to care. So this was honestly an eye-opening class for me. And here are my references. A lot of these were collected throughout this class and really helped hone my understanding of what health informatics is. And thank you so much for watching.